my sunshine, my only sunshine. You make me happy when skies are gray. You'll never know, dear, how much I love you. Please don't take my sunshine away.
Hi, my name is Crystal Putzen.
And my name is Naomi LaFleur. Today we will be presenting a mid-range theory entitled Postpartum Depression
By Cheryl Beck. First, I'm going to tell you a little about Cheryl Beck. Nursing is a profession that requires an atypical type of person. This person has to exhibit characteristics of caring, compassion, and a hunger for knowledge. Cheryl Beck is the atypical person that decided to become a nurse in 1970. She obtained her first degree from Western Connecticut State University. After attainment of this degree, she decided to further her education at Yale University, where they offered a blended type of learning which incorporated research training and a clinical specialization. In 1972, she graduated from Yale with the specialty in nursing midwifery. The next 10 years of Beck's life involved laboring women, which became more focused on the postpartum woman. Obtainment of her doctoral degree from Boston University was the next task on her list of achievements. It was during this time her research started to reflect a strong interest of postpartum depression in women. She learned that there was no exact definition in the Diagnostic and Statistical Manual of Mental Disorders to diagnose postpartum depression. Also, she stated that she reviewed other literature on postpartum psychosis, postpartum depression, and maternity blues, and noted that there was no clear delineation between these concepts. Due to these findings, she started to formulate a theory regarding postpartum depression, and in 1993 she published her substantive theory titled Teetering on the Edge. Middle-range theories allow nurses to be able to apply and use actual theory in a specific circumstance. These types of theories give rise to research questions that help identify different nursing practices and allows for a greater understanding by the nursing profession of how to apply the theory. The postpartum depression theory applies specifically to the setting of postpartum and excludes other settings. It also is a testable theory that is clear and concise.
Development of the postpartum theory. Beck became a registered nurse and worked in the postpartum and the nursery departments. With obtainment of her certificate of midwifery, she was able to focus on mothers after giving birth. Beck conducted several studies where she recognized new and different theoretical sources for each study. Her first study recognized Kallazy's phenomenology, which stayed true to a mid-range theory. Later studies, she acknowledges Sichel and Driscoll's model that represents women's emotions during the postpartum stage as an earthquake. Beck recognizes this model as how a woman's brain reacts to the influx of hormones during pregnancy and how these emotions can bubble over and start to make fault lines like the Earth's crust. Throughout Beck's works, there is an explicit intent to comprehend pregnancy, birth, and motherhood. Beck conducted a qualitative study that led to the development of a screening tool that recognizes social and psychological problems and processes associated with postpartum depression. Once she collected this information, Beck noted that the main concept of these women was loss of control. This is how she developed the title.
We looked up several primary sources to gain a better understanding of the postpartum depression theory. Cheryl Beck published many articles that support her theory. She has written over 100 journal articles on postpartum depression, meta-analysis, birth trauma, and is also employed on the editorial board of Advances in Nursing Science, Journal of Nursing Education, and the Journal of Nursing Measurement. The primary sources utilized were Postpartum Depression, It Isn't Just the Blues by Cheryl Beck in 2006, and that was in the American Journal of Nursing, and The Predictors of Postpartum Depression, an update by Cheryl Beck in 2001, and that was in the Journal of Nursing Research. In addition, supplemental articles that analyzed her theory of postpartum depression were From Practice to Mid-Range Theory and Back Again, Theory of Postpartum Depression by Lasuic and Ferguson in 2005 in the Journal of Advances in Nursing Science, and also A Middle-Range Theory of Postpartum Depression, Analysis and Application by Marsh in 2013, and it was in the International Journal of Childbirth Education.
These are the basic considerations of the postpartum depression theory. Metaparadigm. These concepts include person, nurse, environment, and health. They allow a nurse to identify a scope of concern for their profession. The concepts are either acutely or obtusely represented within the theory. A client is understood to represent a wholeness or a whole being, which Beck classifies as a woman. Environment. This can be influenced by a client's health. Environment is described as ranging from multiple outside factors such as socioeconomical class to individual factors of marital status. Health. This is not explicitly defined in Beck's theory. It is noted as how a person perceives themselves in relation to the experience of childbirth. Nursing. Prevention and early detection of women who are at risk of developing postpartum depression is the foundation of this theory. Jean Watson's theory of caring is noted to have a great influence on Beck's development of her own theory. Nurses caring for women after childbirth and interacting with them allows for a trusting relationship to develop that the mother feels comfortable enough to share her true feelings regarding childbirth.
Beck's theory includes 22 central concepts and definitions. Concept number 1 is the mood disorders. This consists of maternity blues, which is normal reactions that may occur after delivery, which require support and reassurance. Symptoms include crying, anxiety, fatigue, and irritability. Postpartum panic disorder. This is discrete periods of intense fear. Postpartum obsessive compulsive disorder. And this is when mothers can recognize that these obsessions are formulated from themselves and they can resist the urge to do harm to their babies. Postpartum bipolar II disorder. This is hypomanic episodes which include inflated self-esteem, racing thoughts, or decreased sleep. Postpartum post-traumatic stress disorder is birth trauma where women feel powerless. Postpartum psychosis. This is a psychiatric emergency with high rates of suicide and infanticide.
Concept 2, loss of control, has 4 different stages. The first stage, encountering terror, a depression suddenly occurs. There are 3 different symptoms noted: horrifying anxiety, relentless obsessive thinking, and enveloping of fogginess. Dying of self is the second stage, where the normal self disappears. Isolating is noted during this period. The mother is just going through the motions without recognition. The third stage, struggling to survive. Improve consequences of dying self. The APNs are utilized by the client. Fourth stage, regaining control, is an unpredictable and slow process, and the mother often has feelings of missing out or feeling robbed of being able to be with their baby.
Concepts 3 through 15 are predictors and risk factors for postpartum depression. These include prenatal depression, childcare stress, life stress, social support, prenatal anxiety, which can occur during any trimester, marital satisfaction, history of depression prior to the pregnancy, infant temperament, self-esteem. This is one of the strongest predictors, and this is the mother's view of the self. Baby blues, which lasts no more than 10 days, socioeconomic status, marital status, and unplanned or unwanted pregnancies. But this doesn't always mean that the child is unwelcomed. The woman still has to cope with the consequences of the childbearing.
Concepts 16 through 22 can be seen in a postpartum depression woman. Sleeping and eating disturbances include insomnia and loss of appetite, anxiety and insecurity, a high alertness to minor issues, and sense of being overwhelmed, emotional liability, crying for no reason, mental confusion, a lack of concentration, loss of self, a loss of personal identity, guilt or shame, not performing up to the standards of being a good mother, suicidal thoughts, a plan to escape the depression by ending one's life.
These are the major assumptions seen throughout the theory. The postpartum depression theory has the assumption that this is a woman's health problem that affects the mother and the child, which can be seen in the present and future health of clients. The second assumption is that there is a connection between postpartum depression and the changes that a woman's body goes through when she is pregnant and after giving birth. When Beck conducted her qualitative study, the assumption was made that the participants of the study were aware and able to effectively communicate their lived experiences.
Theoretical assertions. Whenever a theorist is trying to explain a relationship between two variables, a theoretical notion is formed. Beck relates variables that women experience throughout their life and believes these variables will contribute to the experiences of giving birth. The crack in the surface that results in a bubbling over of emotions of new and previous ones during birth is related to the earthquake model. Other theoretical assertions are described as how the woman has an additional hormones in their brain from pregnancy. With the increase in hormone levels, this can result in a higher susceptibility of mood disorders. Beck states that the social stigma regarding childbirth is that it's supposed to be only a happy time, which negates women to seek help. Preventing this debilitating mood disorder starts with early detection, which happens through early screening processes before a woman even gives birth.
In summary, Beck states that during formulation of her theory, the research conducted regarding experiences of postpartum depression were observed and utilized in a holistic fashion recognized in nursing. The nursing meta-paradigm concepts are developed with women seen as a whole being and functioning in the framework of a person, health, environment, nurse complex. With the goal of nursing set on prevention and early detection, screening and diagnosis are critical to the concept of this middle range theory. Beck did not formulate a schematic model for postpartum depression theory, although this figure represents all 22 concepts that she identified. The first concept elaborates on the multitude of mood disorders that the mother may experience during the postpartum period. These mood disorders include maternity blues, postpartum panic disorder, postpartum obsessive-compulsive disorder, postpartum bipolar II disorder, postpartum post-traumatic stress disorder, and postpartum psychosis.
Concept number 2, loss of control, has 4 different stages. Figure 2 is a drawn-out version of each of these stages. The first stage, encountering terror, has 3 different symptoms: anxiety attacks, relentless obsessive thinking, and enveloping of fogginess. These are conditions that the mother will experience. The second stage, labeled dying of self, is having an experience of alarming unrealness that is related to an outer-body experience where the person is just going through the motions of childcare. Also during the second stage, mothers are noted to isolate themselves and may have thoughts regarding self-destruction. These are seen as consequences of loss of control. This third stage is represented as a struggle to survive. Many times, this is when the mother will start to look for options to overcome these feelings of loss of control. They seek outside sources in forms of prayer, support groups, and visits to general practitioners. They are developing strategies to fight off these feelings associated with postpartum depression. The fourth stage is regaining control. This process cannot be set in stone, and it is an unpredictable transition where many times the mother may feel a sense of loss of time with their infants. These are consequences that the mother may experience.
The next set of concepts on Figure 1 are prenatal depression, childcare stress, life stress, social support, prenatal anxiety, marital satisfaction, and a history of depression are utilized in the testing created by Beck to identify predictors of postpartum depression. The other concepts included in the third portion of Figure 1 are infant temperament, maternity blues, self-esteem, socioeconomic status, marital status, and unplanned or unwanted pregnancy. All of these concepts are risk factors and predictors related to postpartum depression. The final concepts represent symptoms of postpartum depression. They include sleeping and eating disturbances, anxiety and insecurity, emotional liability, mental confusion, loss of self, guilt and shame, and suicidal thoughts. Though Beck recognized 22 concepts of postpartum depression, it is understood that all 22 concepts will not be seen or experienced by all women. Women may only experience one of the concepts and may not have the other burdening concepts identified.
The logical forms that Beck utilized in her mid-range theory of postpartum depression were inductive and deductive reasoning. Deductive reasoning is formulated on the basis that something is understood. It allows one to identify something specific and apply to a general view. Inductive reasoning gives a generalization to a whole group to identify something specific. Mid-range theories allow for the development of practice knowledge. Beck identified a clinical problem experienced by women, which was loss of control. and through refinement and testing, she has created a theory that can be utilized and applied in specific settings known as postpartum. Beck has continuously used linear efforts of observing experiences in the development of her theory. The flaws of deductive reasoning related to Beck's theory is that there is a possibility that the validity of the results received from the candidates could be skewed due to emotional and social factors.
Beck's theory is used throughout nursing research, education, and advanced practice nursing. A postpartum depression screening tool created by Beck is a 35-item Likert scale questionnaire used to measure the severity and type of postpartum depression. Nurses have to become aware of the signs and symptoms of this mood disorder and identify risk factors associated with the development of it. Clinicians need to be able to provide anticipatory guidance with referrals to online support groups such as Postpartum Support International and Depression After Delivery. The nurse must help the woman set realistic expectations of what it means to give birth and be empathetic when listening to their concerns. Lastly, social support is needed. This can be provided by the family if they are aware of what the woman is experiencing. And as a nurse, there is a need to help facilitate this awareness to other family members. The advanced practice nurse must use specific criteria and be diligent to recognize the symptoms of postpartum depression. Education provided by the APN on different stages and emotions that the woman may experience after childbirth and where to seek further help are all valid information that needs to be provided by the practitioner.
Our case study. Gina is a 17-year-old high school senior who has been dating Ben for the last 2 years. She is on the cheerleading team and she has earned a scholarship to attend LSU in the fall. On May 6th, only 1 month after her senior prom, she realizes that she is pregnant. Gina is very self-conscious about other people's opinions, and this was not a planned pregnancy. Ben is also feeling overwhelmed about the idea of becoming a father. He makes suggestions to Gina, including abortion or adoption. She rejects both of these ideas and feels a lack of support from Ben. She decides that she is going to become the best mother that she can and follows a routine checkup appointment with Dr. Mays. There she is seen by the advanced practice nurse, Faith. Faith listens to Gina's concerns and ideas about motherhood and decides to use the postpartum depression screening tool developed by Beck to see if she has any risk factors associated with this mood disorder. 10 months later, Gina gives birth to a healthy 10-pound baby girl. She has been having regular checkups with Faith, but has noticed some emotional changes in Gina that cause her to have more in-depth questions regarding Gina's perceived idea of childbirth. Gina states that she feels so exhausted and feels like she is not performing up to par as a mother. Faith has prepared Gina that she may feel this way after the birth of her baby. Gina states that she has utilized the support groups that Faith referred her to and states that she feels she has a lot of support and is thankful that she can talk to Faith so openly and with other members of her support group.
Implications for the advanced practice nurse. Postpartum depression theory brings out the relevance of the disorder. Postpartum depression, described by Beck, is a thief that robs women of precious time together with their infants that they had been dreaming of throughout pregnancy. Maternity blues, which can quickly turn into postpartum depression, affects on average of 50 to 75% of new mothers. A staggering 13% of mothers will experience postpartum depression. With this abundant knowledge of how crippling the disorder is and how many people it affects, it is important to be able to identify, prevent, and/or treat early. Beck has developed not only the theory of postpartum depression that allows the nursing profession to recognize it as a disorder, but she also has identified criteria that APNs can use to give an actual diagnosis to a patient.
In conclusion, this theory has brought clarification to the term that had no true definition or treatment plan. Cheryl Beck performed multiple studies that allowed the development of the middle-range theory postpartum depression and the substantive theory labeled teetering on the edge. Through these working theories, clinicians are now able to acknowledge certain risk factors and symptoms associated with postpartum depression. The development of the postpartum depression screening scale by Beck allows clinicians to score a patient and rate the severity of the depression, which further helps to develop a treatment plan. The 22 different criteria recognized by Beck can be acknowledged in a woman in a single item or may be exhibited in multiple ways. There is no set way to identify a woman with postpartum depression, but through the utilization of Beck's theory of postpartum depression, she allows an unfoggingness to occur with set criteria that a patient must display in order to be diagnosed with this disorder and be able to receive the proper treatment.